And so what was your cue? What did you ask Camille? Take some deep breaths. Yeah. This doesn't have to be rocket science. That's it. So let's look at it together then. And she's taking deep breaths. And now what I like to do before I even say anything to a client about what's going on is I'd like her to tell me. So the question in this case, the magic question, might be more like, what area of your body is moving, or do you feel moving right now?
My chest and my belly.
Chest and belly. So she said chest and belly. Take a few more deep breaths. And now you guys get to correlate that to what you see, because she has a feeling and you have a sight. Now there is one more thing I'm going to ask for in this assessment, and that is, and I know I haven't coached you guys, we're going to get deeper as we keep going, and that is for RPE, rate of perceived exertion. So RPE means, Camille, on a scale of 0 to 10, 0 being like breathing feels like heavenly angels are breathing for you, and 10 is like, I can't breathe, I literally can't take a breath. Where are you on the scale of ease or difficulty there? What would you give yourself?
As of now, I'm at 8, 9.
Oh, it feels difficult to you? Or
no, I'm
opposite,
sorry, the opposite.
Which means you're at 1 or 2.
I'm at 1 or 2.
So her RPE is 1.5. This is what almost every client will say. Now,
all right, you mind laying down?
But as soon as you get me do something, that's going to change.
Yeah.
Thank you.
Lay down on your back?
Yeah.
Right?
If you feel comfortable laying on your back.
Not for too long, but
okay.
Let's try.
And if it's really uncomfortable, then just lay on your side.
Yeah.
It can be the same thing. But maybe try a couple on your back.
Sure.
If you're open to it.
Yeah.
All we need is like maybe 3 on your back or something like that. And then the immediate thing that you see. Now you don't have to say it, although sometimes it will be prudent to say it, but let's ask her, hey, on a scale of 0 to 10, what do you feel?
Much harder.
It's much harder. She's pregnant. You guys were not. Sorry, you don't know what that means, do you? She has the weight of the baby. That's what it means. For most people in this assessment, it gets easier when you lay down.
Oh, okay.
For most of your clients, it will get easy when they lay down. That's what they'll report. In the case of 3rd trimester, you can lay on your side, do a few that way. In the case of 3rd trimester pregnant women, it will oftentimes be harder. So we've gotten our information. You're done. Thank you very much. What was the what? Oh, she indicated that it was harder, much harder.
I have a question.
Well, so really all I'm trying to get is it easier or harder? So I just end my question right there. That's all I want to know. Easier, harder, or the same? In her case, it's harder. With a client who says that it's easier, what it gives you is an immediate lead into this is what it's supposed to feel like. In her case, it's okay. It's just part of the process. We're gathering our information. We will educate her on what's supposed to be happening, later, so to speak, right? Later in the assessment, yeah.
As far as the side, you don't have them breathing too much on the side, because we didn't go over that before she came.
Yeah. It's not. We'll see if the other women feel comfortable on the back. Remember what she's doing. I think is do you sleep? You don't sleep on your back. Is it actually physically uncomfortable for you? So it's physically uncomfortable for Camille to be on her back at this stage in pregnancy, which is the standard protocol for many pregnant women. This is why the rules are be careful of putting them on their back, right? So she's feeling that, right? And whether it needs to be or not, she's feeling it. Yeah, so she's aware of it, and she knows she doesn't want to be on her back for a long period. Have you actually felt lightheaded from being on the back? Or is it just something you're trying to steer away from?
Lightheaded, maybe not to that point, but really uncomfortable. And it's actually giving me back pain sometimes. Yeah.
Okay. All right, cool.
So I just stay. But I just avoid it.
So let's see if we can give you some more answers to that. Thank you very much, ma'am. Would you like me to help you up? We're coming up.
I didn't know if I was supposed to come up.
Yeah, no, don't do anything beyond what you need to, for sure. So the assessment we're doing is, no, pelvic tilt standing. Yeah.
I was like, are you going to get me back on the floor? No.
So maybe go sideways to the...
Sideways,
yeah.
Now we want you to try to touch my hand with your lower back.
So Andrew's using his cue of, he said, I want you to touch my hand there.
Do you want me to stay,
Yeah, so I want
stay
you to
there?
try to tuck in. Just
Oh,
there.
okay.
Now, by the way, you're allowed to show her. There's nothing wrong with that. I'm going to actually do it here. What I'd like you to do, Camille, is to do this. So it's kind of like you have a bowl. Now, if you notice some things about Camille, she has bent her knees, which is an indication that something's tight. So now that she's shown us that, Camille, feel free to stand up if that's okay for you without having to sort of squat into it, and then see if you can keep going. And the fact that she can't without moving her knees indicates that what types of things are tight? The simple lumbopelvic ones are going to be that the same areas are overactive, lumbar and hip flexors, and so she's having difficulty moving through it, so she has to do this to produce the movement she thinks she's supposed to produce. So she's overactive in the hip flexors and overactive in the lumbar, but isn't that a cool piece to add to the puzzle? Because she already came in verbally telling us she's overactive in the lumbar, and now we've just put our second puzzle piece together on her. So now we're building our puzzle piece. Now, what else is likely going to be then underactive? Glutes and? Specifically part of the core? Lower abdomen. And that's it. Yeah. So again, we can make this fast, Alex. Let me see what I'm indicating. Oh, basically, it's just a reminder of, is she neutral or is she anterior posterior? That's not necessarily. No, as natural. Like as she's moving, where is her dominance? Which is going to be her standing natural. Oh, French. Oh, because you recognize where. Oh, cool. Okay, so you're doing a squat, right?
Doing a squat. So what are we gonna do? Pretty much just kind of like squat, thinking about sitting back a little bit. Good. As low as you can comfortably go. Okay. Good. Yeah. And come back up. Very good. Can you repeat that 2 more times for me? Is that too much to ask?
No?
And I would just say keep going until, Camille, we tell you to stop. Now, of course, if you feel like you need to stop, Camille, let us know, okay? As long as you're not having pain or something from it. Okay, and then right off the bat, Alex, there you go. Where are you feeling it?
It's actually pulling on my knees.
It's pulling on my knees. She's actually touching these areas of her body, which is what muscle?
Pretty much.
Quads.
Anywhere else that you're feeling it?
No?
And we're done. Done with these. Now, this is squat, so let's see. I don't know, are you able to do this comfortably? Oh, yeah. Oh, yeah, okay.
I'm actually very comfortable.
Okay. So she's capable of getting there, great. Give her the yes or the 1 point for that or whatever. Awesome. Basic. Well, on the very basic level, you're looking to see if they get down there, period. And if you have eyes that understand what the rest of it means, which is not this course, but other courses, then you can start to surmise other things, yes. So next we're going to do a lunge. And I would suggest doing the split squat, Arlen.
We're not going to the twist? The twist was next.
Oh, is it next on the? Oh, I don't
Doesn't
care what
matter.
order we go in.
All right,
You choose. You do the one you
want. So
want.
for the lunge, what we're going to do is we're going to have a split stance. So you're going to have a little bit longer than our normal stride. And then we're just going to come straight down to a comfortable position. Come all the way down as possible.
I would be careful
knee
with
on the
all the way
floor, or-
down. I would
Well-
say just kind of do what is.
Most comfortable.
Yeah, exactly. Just kind of mimic that. See if you
And
feel
you don't want
comfortable
to
doing
touch the
it.
ground with your knee.
Did
How's
you-
that feel?
It's hard.
It's a lot harder. All right, come back up. And now how many reps?
Keep her going till we say stop. Or in this case, when there's half and half, hey, give me 10 on each side. You told her to not go to the ground. Yeah. Okay. And where does she feel it? In her quad. As far as I'm concerned, we're done with the assessment. Switch, balance it out on the other side. Tell if there's anything different. By the way, you can start to look at other things here, both on the back side and the front side. Where the excessive arch is, where the lack of movement may be on the other side. Is it the same thing? You asked her where she feels it?
Yeah, she said she just feels really
Unstable.
Feels really
Just
unstable.
She's going to the quad because she's loaded in front.
Okay.
All right. Thank you.
You're welcome.
Appreciate it.
No, that's what she chose. That's her natural. Now maybe if I had reason to widen a stance, but the answer's not going to change. For that.
Hi, how are you?
My name is Mike.
Hi, Mike.
You can use this if you want or not. Yep.
All right, so what we're gonna do is we're gonna grab the stick, we're gonna put it right here on our back, and I'm just gonna ask you to rotate and look back, and just keep going, both sides.
Okay.
Yeah, so that's a great cue. He showed her, he told her what to do, very
And I
simple,
want you to
very
look
Do you want me
concise.
to?
You can face me, I just want you to look back every time.
There you go. And again, the words I typically use are look at the wall behind you, pause, and then look at the wall behind you the other way. And the magic question?
And let me know where you feel it most.
I guess in my back here, like
Your
high,
lower back or your upper back?
upper back, upper back.
So more on your lats or your elbows in the middle?
No, more on my here.
On your lats. okay.
Yeah, my legs.
Could also be mid-thoracic type stuff. Pause when you get back to this one, Camille.
So turn again. Pause that.
Hold there. Are her hips going about 45? And are her torso going about 45? Great. Let's take the bar off. Put your arms down and keep going. Let's just see if that changes. Keep going. Imagine you had to do another 20 of them. Tell us what would get fatigued or tired in you there.
Same part.
Okay. So she has some mid-thoracic and lat or something in there.
But you still give her a 1 from 45, right? Well,
Yeah.
at this point it doesn't,
Sure.
it doesn't really matter.
Yeah, I mean, I often joke that most people will pass this one because they do make it there, because especially pregnant women are flexible, you know, like stuff like that.
Would you say she's feeling it there just because she's already been doing it, or
Just because.
like by keeping her hands down? Would you say she's feeling it back there?
Yeah, she's feeling it either way. I'm comfortable with that. I just wanted to see every once in a while it does change a little bit. Honestly, you know what I was most interested in? I wanted to see if by getting her to do more, she's only done less than 15 at this point or something. I wanted to see if it was going to creep down to her lower back, which is where my expectation kind of is. But she's got a lot of back tension going on, that's for sure, lower and middle. Cool.
So we're going to do a bend. So we're just basically bending down as if we're going to pick something up and then come back up. Be careful not to drop your bottom too low.
Okay.
Now, be careful not to drop your bottom is coaching that I would say do not start with, because that coaches her on what to do or not do, and I want to see what she's naturally doing. The second part of that is she's pregnant, and so she's going to be a little different than what your normal assessment is. So go ahead, and the words I like to use mostly are go touch your toes, and then come back up. So touching, because everyone kind of understands, oh, touching the toes. When Alexa says, as if you're picking something up, that clicks things in people's brains that get them to all of a sudden think exercise oftentimes, right? So that's all. Just be as minimal with, like this assessment is literally touch your toes, done. You don't have to say much. Go ahead and keep going. And then tell us, as you do this, where would you get tired?
It's actually more, I think, on my belly than my back, because I can't, like, it just blocks.
What's happening, this is incredible to see, because what's happening is this big belly, right, from pregnancy, is coming into what? Her thighs. And then what's happening? What does it symbolize in terms of the TVA? She's actually getting a concentric type of contraction that's stabilizing her, because the baby pushing against the spine is acting as a core stabilization, which means that she's not going to feel it in her back, which is where she would feel it otherwise. So she just created through that because of this exercise. So again, this is third trimester. Things that you'll see, definitely not the same as first or second trimester before this belly is grown like this. Cool. Thank you. By the way, the fact that the belly is here is going to, that's part of the reason. I'm not harping on the fact that she's kind of squatting, because that's just the nature of her belly. She has limited range right now, whereas any other client, I would not allow them to squat. I would coach them out of it after they showed me that that's what they wanted. There's only two reasons, if I think of them, why people squat when you ask them to bend. It's one, because they're avoiding back pain, or two, because they've already had a back surgery or something like that. Otherwise, the instinct of the human should be to drop in like this. This is a bend pattern. Unless you, oh no, I'm sorry, I'll give you another one. Unless it's been sort of fitnessized out of you. There are some people who have been told they should never bend out of the spine because they're in trainers or whatever. And so what they do now is they only do this rigidity of a movement. And that's not a primal movement pattern. That's not a healthy pattern long term, although it's a great solution to, initially. That's again why we can't release our clients thinking this is the only way to bend. We have to release them, showing them how to bend in accordance with daily life. Who's next? We can go. Yep. Her brain did not activate her core. Her core was externally activated by the thigh pressure on her midsection.
And now we're doing the row.
So now we're doing, let's say, a row. Oh,
Do we need
let's do a
dumbbells?
push-up, and will someone grab 2 dumbbells while we do this? Let's do the push-up right now, though.
How would I have to do a push-up?
On the knees. So oh yes, this is going down.
I would say she's gonna run out of space.
Well, then we're still going to get the primary activation. Actually, I tell you what. I want to. Oh yeah, we can do all sorts of things. We can do, but I'm going to show you it can be done here. I think so. Yes, she has a big belly, but Camille, do you feel comfortable getting into this position here?
Yes.
Hands and knees, and then I want you to do some version of lowering and raising to the degree that you feel comfortable with it.
Yeah, I think so.
Okay. You can bring those up. Thank you so much for being here.
You want my
Whatever's comfortable for you.
Okay.
Oh, sorry. Yes, that sounds like what you were going to say, though. Magic question?
And where do you feel it?
same thing here.
So you're feeling your, oh, that's interesting. Will you take a few more if that's all right? Let me watch.
And is that something she could potentially be feeling first just with the gravity of the baby?
Where in your upper body do you feel it? Yeah, we'll get to that in a second.
My upper body, just I guess in my arms, but
Kind of back here.
And you're sort of
Yeah.
pointing back here.
yeah.
Sure. Last couple. Now what's interesting, thank you, yep. What's interesting is that, feel good? We're gonna have you up one more time then. And Nikki? What's interesting is that what we're seeing is that Camille's, and sometimes this happens, her core activated because she was in this position and her brain decided to turn it on. That's it, that's a good response. We want that response with many things. So there, believe it or not, you could give her a yes for that her core is starting to kick on. Is it complete with diaphragmatic breathing and things like this? No, but she's got some activation, that's good to know. And you know, sometimes it happens this way because sometimes fitness people too who've been trained go through pushing and pulling and they get really good at scapular adduction and really good at chest loading and they'll sort of excel there and then kind of fail the other things too. So, you know, everybody has a little bit of something different, so that was great. So now we're doing a bent row. You got your dumbbells right there? Good weights, Michael, perfect.
All right, so we're going to start off with dumbbells. We're going to go overhand grip. I'm going to bend over and pull towards you in this range of motion.
Yeah, so that was a pretty good direction. You got her to do what we want. I'll explain it, Camille. I'd like you to keep going. I'll explain it as, you know, imagine you've got to pick something heavy up, and for our assessment, we just want to see it.
Yeah, my lower back right now is
So she's just reported lower back.
Is that the only place you're feeling it? Or
up to here.
okay, so like mid-back area and
Yeah.
low back.
All the way down.
Anywhere in your upper body at all, or just there?
Great question.
No, my upper body is fine.
Is it more of a discomfort or is it more of a pain?
In my back,
Yes.
it's more of a pain.
So we were
Her overactivation is becoming a pain. This is how back pain starts. Her overactivation in the lumbar is becoming a pain. By the way, it's so much there. Great questions, thank you. It's so much there for her that she's not even able to stay in the exercise long enough to get where it feels in the upper body.
Looking at it, you can kind of see this forward when she's pulling. So would you mark that as
Oh, sure, yeah. Or, well, again, it's up to you in your notes. You could say, no report, too much low back, and then give points accordingly. Or you could say, doesn't look on par to me or whatever. You know, whatever it is that makes sense to you. That's, again, the art of how you want to use this assessment. So there we've had an assessment now, and
And just so you know, like my heartbeat, just with that is
it's
like,
pretty up there.
Yeah.
What I'd like to do with you is Let me just do an experiment standing. Normally what I'd like to do is take the next 10, I think I might do it. Lay on your side. I'm sorry. I know, I'm having you go up and down. We're now going to help you, coach you out of that. I'm going to see if we can get a big, change right here in the next few minutes. So what I'd like you to do is take a big deep breath in. By the way, be as comfortable. Like sometimes in these environments it doesn't work out as well. She has 20-something people watching her. And as we know, diaphragmatic breathing is, oh yeah, please, thank you. Diaphragmatic breathing is parasympathetic, and right now there's some sympathetic going on, right? I'd like you to fill my hand as much as possible. We have a pillow. Do you want to put the pillow under your head?
Yes, that would be great. Thank you.
I want as much movement out of here as possible, and I know I'm not explaining it to you.
Do you actually have a block? Yes. Does anybody have a block?
Foam roller, maybe?
Oh, foam roller?
Right there.
Perfect.
Oh, there's a block?
Thank you.
Awesome. So, to make a long, I'm going to come and explain this to you, outside of here, right? So you'll get, if you want. That was part of the deal, right? I don't know if you were told that. Yeah. So right now we're going to try to see if we can get a 10-minute quick change in you. To make a long story short, we're identifying that, you've heard us talk here today. You have, we're saying that your diaphragm is a little underactive, your breathing muscle. We're seeing that your TVA or your core here is a little bit underactive, and these are allowing pressure to build up in your back. Make sense? Mm-hmm. So today you could literally walk out of here without that pressure. Great. You ready to do it? Mm-hmm. There are some other things, but we're going to go for this one right now, okay? So if you can do this with me, inhale big. That turns on your diaphragm if we get your belly to fill. And that's the key. You got to get your belly to fill and try to avoid, bypass. And you're able to do it, right? And then exhale and make it smaller, 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 smaller. All through the nose if you're able to. Inhale nice and big into the belly. Hi, baby. That's right. Sometimes I forget there's two people here with me. And then exhale, draw in, draw in, draw in. Now take that a few more times. So she's clearly capable of doing it in a lying position. By the way, keep going. I need you to just get really comfortable with this because this is what I'm going to ask you to do. In a moment, Camille, in a few minutes, I'm going to ask you to stand up and to use this level of movement in your belly to do a squat or something like that. So you're going to we're going to redo one of your assessments, but with the core breathing and see if it makes a change in you, okay? Which one did she say she felt in the lower back? The row. There was one before that too. The pelvic tilt she felt in the lower back. Okay.
The dumbbell.
The dumbbell one, yep, that's the bent row. Oh, the twist, that would be a good one potentially too, okay. You see, if we can go right at the ones that were, now that's asking a lot in the next few minutes. We're gonna put me on the spot here and see. Now what I'd like you to do is I need to she's getting it, so now I want you to keep doing it. And by the way, if you need to move or something, let me know, right? I want to complicate it now so she can complicate it later. So one complication we can do is as you breathe, I don't care if it's inhale or exhale, I'd like you to just lift this top leg up. It's not a big deal, it's just a complication. And then put it down. And did you see how you forgot about that? So now I'd like you to do it with that. Okay, so time out 1 second. She just went to inverse breathing. This is totally normal, by the way. The moment we complicate it with even something very simple, she reverted her breathing pattern. When you inhale, there's air here, and it physically comes in and fills the belly. And then, yeah, I know you know this. And she's on the spot, don't give her a hard time. Okay, better. Keep doing that, Camille, that's perfect. Just kind of keep going. I need Camille, literally, I need to just chill out because I need her to make this a new program. She is reprogramming right now. Remember in our studies, we know that things like it takes 3,000 to 5,000 repetitions to reprogram a poorly learned motor program, right? So we're only going to get in a few hundred at best right now and see what kind of change we can make and see if she can carry it through to a functional movement pattern. It's not guaranteed. Maybe in 30 minutes it could be guaranteed. Now you're doing really excellent, Camille. I think it's safe to say she's got a rhythm. That word is very key. She's developed a rhythm. She has a synergy or a harmony occurring. It's becoming more natural now. She's getting into a flow. She doesn't have to think as much, which allows us potentially to add the next variability. If we added it before, it wouldn't work.
James, if let's say she feels comfortable on her back, because sometimes it seems that it can be a little bit easier even if you move the leg, but could you tell her to lift an arm, or it doesn't matter what
That's
she's
right.
doing?
That's what I normally do, is on the back and lifting one leg at a time.
Oh, okay.
The what's called the supine lower abdominal in the Czech curriculum. So what I'd like you to do now is, now here's the key, I'm gonna put you into another position like this. This was, you were comfortable here, right? And what I'd like you to do though is remember that moving from there to here is an exercise. So I'd like you to practice using your breath
breathing.
to move there, okay? Good. Sometimes it takes, that was cool. She almost did it twice, right? She paused in the middle. So now the same thing. I want to see if you can inhale and exhale. This is just a different position. And you fill your belly. And I don't want any change here. Now, you know, many programs will put a bar on her and do. I'm just going to keep it very simple right now and just tell her, try not to move. I'm not really worried about the other postural mechanics, by the way. There's things we could talk about up and down the chain. I need her focused on one. That's this right here. I want your belly to get filled and then your belly to draw in. Now, because she's over-programmed where? In the lumbar, she's doing that. So I'm going to now tell her specifically, please try not to arch your back anymore as you do this. You're welcome to round it there. Try to keep it there. Now move your belly. There you go. And don't let the lumbar leave my hand here. Just leave it right there. Yep. I want this to go up and down off my hand. There you go. So I had to coach her a little more specifically. Now she's getting more of the belly and less of the anterior tilting. What this is reminiscent of is you now learning how to use your core without relying dominantly on the lumbar. You get this, right? Mm-hmm. Like you can almost surmise what I'm going to say as you walk out of here, that you need to start using more of this now. Does that make sense?
Yeah.
And your back will not have the pain anymore, right? Now I'm going to make it more complicated. We're 6 minutes in here. And I'd like you to just barely lift a leg, just enough for a piece of paper to go under as you breathe. Now remember never to lose the breathing, and then put it down, and then you can lift the other one. What program is this going to mimic? Gait pattern.
Oof, it's hard.
Where do you feel it?
I lost my breathing.
She lost her breathing. So again, standard, we're going to cross lines here. So take your time, get back the casual breathing, and then when you feel balanced again with the breathing and more in harmony here, then you can try again to lift a leg, okay? Good, and then down, and then, yeah, exactly, with rhythm of your breathing. Now I'm going to give her a couple minutes here potentially. I know she's going to start getting really tired up here, everyone does. In the upper body, so let me know if it's starting to get there for you, because that level of stress here could start to take away from her capacity to breathe. She's overall getting better though. She's getting it. We're in the right direction here. I would like to see ultimately, if you're able, Camille, to kind of go breathe one way to lift, breathe the other way to lower, breathe the other way to lift with more repetition back and forth, let's say, you know what I mean, not pausing. Now that's an almost dangerous thing for me to say because I'm rushing her, because I have a timeline. Inhale, exhale. And I don't care if it's an inhale or an exhale right now, I'm just telling you what she's doing. She's inhaling to lift. This is the normal pattern that people will choose. They'll inhale first, and then because why? Where's the TVA most strong? Eccentric or concentric? So she's choosing inherently her eccentric TVA contraction. She also has, I don't know if you guys can see this, but there's a tremble starting. That's neurological learning. So she's making serious connections now that have not been made for probably decades in her life in terms of using core for movement. Certainly not in pregnancy, though. Forget about the rest. Since having a pregnant belly, she has not moved like this in communication. And so now what we're seeing is there's a communication, at least in this position. Take your last few here, Camille. And then you can sort of kneel your hips back on your feet or something like that. Is that comfortable? It's okay.
Yeah.
So will you stay there and just breathe a few times? You're welcome to put your hands here if that's comfortable for maybe 5 breaths or something like that. All I'm doing is making this so sequentially tiny so that we don't lose the program that she's just begun building. The question is she still activating her lumbar? Should I coach that? I'm at the point right now that I need to keep her here, and I'm not so worried. I think we've crossed the line enough that that's going to be okay. And then sit up a little bit more. Is this comfortable for a moment? You can be on here if you want.
Like this?
Yeah, I just want to see if your belly can work here. I didn't want to take her out of her sort of position here. I don't want to jar. There's a switch in her brain. And if I move her to another position, the switch in her brain will go back to the old pattern. So I'm trying to keep her in these, like following with me. So inhale, fill. And by the way, she's vertical. How's her belly pump? By all intents, we just fixed it. There it is. So she's capable of using her core muscles to protect and to take tension away from the back, right? Take it a few more times so that you feel strong with it. And then imagine, close your eyes for a moment on the next few, and imagine you're going to do a squat and pull that in. And you're going to breathe with your squat. You're going to go down with your squat with an inhale or an exhale. And then you're going to breathe to come up in your squat. And then you're going to pick up some weights. And you're going to pull the weights with your breathing, solidly protecting your back. And then when you're ready, I'd like you to stand up. Use your core breathing. Take a few breaths right here. Show us. Good. There's some great belly movement going on now. Now you got to take a couple here, Camille, and feel comfortable with it.
I'm a dizzy.
There's the dizzy.
It's okay.
When people learn to breathe, by the way, it's very common to have dizziness in general, aside from all the other, pregnancy, breathlessness related things. A couple more. It's the low blood volume thing. And then when you're ready, you know that you have less balance when you close your eyes. Just everyone does.
Oh, I'm moving, right? Am I moving?
You are. You're
Okay.
swaying a little bit. But when you do the squat, you're welcome to close your eyes. I often tell people to do that because it gives you a sense of feeling. But don't fall over on us.
Okay.
You know what I mean? So, and then by the way, I'd like you to do a partial one to begin
Okay.
with. Remember, it's all about this. This is the exercise. That is just the accessory.
Okay.
Good. Take a few more. Feel it out. Find a rhythm. Keep going, Camille. You're doing a great job with it. And I want to know what area of your body you feel it in.
Still here, but much less than before.
Still here in the lower back, but much less than before. What area of your lower body will get tired?
My quad.
Your quads. Now notice what she said before. Pain in the knees. Weren't those her words? So it's now moved to the muscle. All of this is exactly what I would expect. And did we coach her on lower body mechanics? No. What she has, it even looks better is what you're saying, right? It looks less knee dominant. You can actually see she's naturally going into the hip loading just a little bit more. What were the other ones we were going to do? Let's go with twists now. Will you use your breathing to rotate you? she had a bar, right? Let's just sort of for consistency, we'll do that. So do the same thing. You're going to look at the wall behind you. Use your breathing to do it. And then go back the other way. And you can go all the way from the left to all the way through the right. Because I want you to tell us kind of where you feel it.
It's harder to breathe that way.
It's harder to breathe is what she's saying. I mean, it's a new breathing pattern. That's expected. Where do you feel it?
Still feel it on my lower, higher
Still
back.
feel it in what we'll call the middle back.
Middle back, yeah. But that's it.
So would you say same amount of intensity, less? Has this
No,
made any
less.
change?
Less.
Okay, so the intensity is less. Is that an improvement? Absolutely. That was 10 minutes of coaching. So now let's go with this one here. Now remember, you're supporting yourself with that, right? So you have a coffee table or you have the changing table, and you're picking up your 16-pound baby with the breathing movement. By the way, I'm not even palpating her. That really helps sometimes, like reminding her. She's doing a great job, honestly. Tell us what area is going to get tired if for $1 million I said go to exhaustion.
My quads.
My quads. Did she report her lower back? No. Why is that? Because now her core is functioning. That's it. Camille, thank you. That was awesome.
Perfect.